हेलो, नमस्ते एंड वेलकम टू आवर पॉडकास्ट। मैं हूं डॉक्टर निदा खान और आज हम बात करेंगे काफ़ी इंटरेस्टिंग टॉपिक के बारे में जिसे कहते हैं लाइपोसक्शन, गाइनोकोमास्टिया एंड बॉडी कंटूरिंग, विच इज़ आई थिंक द ट्रेंडिंग एरा। सो इसी के लिए आज हमने इनवाइट किया है अ वेरी रिनाउंड प्लास्टिक सर्जन, डॉक्टर वशिष्ठ दीक्षित। वेलकम डॉक्टर वशिष्ठ।
Thank you for having me. Hi everyone.
So we hear nowadays a lot of things about liposuction. So could you just introduce what exactly is this liposuction treatment?
Right. So liposuction has been around for a really long time. And what it involves is using small thin tube, right? So we use a tube through small access incisions and we basically suck out the excess fat that people have. And it's primarily used to, sort of shape the body.
So which all areas do we utilize this liposuction technique?
Pretty much everywhere. You can use liposuction wherever you have excess fat deposits. But if I had to, if I had to categorize it, for lack of a better term, it can be used for the neck. If I'm going top down, it can be used for the neck. It can be used for the chest in males, for the arms, for the abdomen, of course, for the back, upper back, buttocks, the thighs, as well as the knees. And again, you have some people who use it even for small cervical gland. So that is how versatile it is.
So how do you select the patient category for liposuction?
If I had to select a patient ideally, like the ideal patient for a liposuction alone would be someone who is close to their ideal weight but has excess fatty deposits in some areas. Like we all know that, despite diet and exercise, there are some areas that just don't go. वो टिके ही रहते हैं. And liposuction works best for that. However, it is used a lot in combination with other procedures as well. Like, you have tummy tucks or you have breast surgeries wherein we use liposuction. So it is a very versatile tool. But mainly the ideal patient, I would say, if I'm only doing a liposuction, would be someone who is close to their ideal body weight, who just wants some contouring to be done. That would be the best patient.
So you mean removing the fat is from the fat layer. So what about the skin? The skin hangs loose after the liposuction?
It depends. Now, in patients who have very good skin quality, younger patients, the skin tends to contract to fit the new mold. When I say good quality skin, I mean skin that is elastic, it is healthy, there are no stretch marks. So with these patients, the skin contracts very well. However, with some people, especially those who have had massive weight loss, those post-pregnancy with stretch marks, or people with thin skin, these don't contract by itself. So we may need additional procedures. It could be surgical, like just, as simple as removing the excess skin. Or, we could use energy devices. So things like a laser or maybe radio frequency, which helps the skin contract better.
Liposuction is basically only removing the fat, or it is balanced along with the diet or something like this additional to it?
If you want the best results, you have to approach everything holistically. You cannot do just one thing and expect magic to occur, right? It is heavily science-based. So liposuction, we use it in combination with other procedures like I mentioned earlier. But for the best results, you obviously have to also maintain a healthy diet and lifestyle. So a good preoperative counseling, where you're preparing yourself well, you're staying hydrated, you're eating healthy. And, once you undergo the procedure, you recover that much faster as well. And post-procedure as well, if you maintain that healthy diet, you're going to maintain your results for much longer. An unhealthy diet, unhealthy lifestyle is obviously going to mess with your results. If you're investing so much into it, going in through a surgery, you might as well do the whole thing. Especially, with an Indian system of thinking, like everyone wants kifayati, bang for buck. So do everything right and mil jayega.
So what exactly do you mean by gynecomastia?
Gynecomastia is actually a very common problem. I mean, if I have to put it colloquially, it is males who have excess breast tissue. This is normal up until around puberty. This is where it starts happening. And then, there are various genetic factors and hormonal factors. So in some men, they tend to persist. Medicines can cause it. Some medicines can cause it. Liver disease can cause gynecomastia as well. But it is exceedingly common, and the most common cause is there is no actual cause that you can point at. It is just, a bad memory from your puberty.
How do we treat gynecomastia?
So there are two components in gynecomastia. One is definitely a fatty component, and the second one is a glandular component. So they have basically a gland, breast tissue that is not functioning. We have to approach both of it, right? So it is treated surgically. We use a combination of liposuction and gland excision wherever applicable. And you're left with a chest that is more contoured, it is masculine, and there are absolutely no visible scars. So that is where the skill and technique of the cosmetic surgeon, of the aesthetic surgeon comes into the picture.
So does this gynecomastia reoccur after the liposuction surgery?
The glandular component will not come back. Once that is gone, that is gone.
Hmm.
With liposuction, not just for gynecomastia, but for anything, the fat cells that we have removed, they don't grow back because you have a fixed number of fat cells after puberty. So whatever fat cells are left in, which we have to keep, in order to have that sort of contour, those can certainly increase or decrease in size, which is why that, maintaining a healthy lifestyle and diet will help you maintain your results. But it can never really come back to what it was.
So if I have to talk about body contouring, what all areas do you look forward for the contour?
So the way I practice and the way cosmetic procedures are shaping up to be, an individualized approach is the name of the game. So you have to adjust and tailor your procedures for that particular patient. There is no one size fits all approach over here that is applicable. Otherwise, everyone will be looking pretty much the same, right? So we have to individualize, see where the patients really require that sort of contouring. Typically, people come in asking for contouring of the face, so we can do procedures like removing excess cheek fat, that is called buccal fat reduction. A double chin, which is something that I also struggle with. But so we can, contour the neck, the jawline. We can contour the chest for males, like gynecomastia is also part of body contouring. Pretty much all areas. I would say the most commonly performed areas would be the abdomen, of course, the back, and the chest for males. And the thighs, those saddlebags and, heavy set hips that some people do have.
What are the common myths that are pertaining to this liposuction
There are
surgery?
so many myths. So some people think it is unsafe. Some people think it is a weight loss procedure. Some people think that it is, a one-shot fitness gimmick. So that is not the case. It is firstly not a weight loss procedure. You don't lose weight after liposuction. The goal is contour. It is not a number on the weighing scale. The second thing is, it is when done in the right setup by a qualified surgeon with good backup, it is an extremely safe procedure. But of course, you read these horror stories about people undergoing liposuction and then, some people losing their lives and all.
True.
But when you look a little more deeply into it, which unfortunately people don't, you will see that these are people, the procedures are done in, centers which are not really having those sort of backups, by people who are not really that qualified or skilled in doing those procedures. That is when obviously you're going to get complications. Otherwise, it is extremely safe. And the other thing is, it is not, jadoo ki chhadi. Even though it looks like a wand, it's not a jadoo ki chhadi. There are a lot of things that go into it. You have to maintain weight, you have to continue with a healthy lifestyle. So then definitely you will get the results that you want. But primarily, I guess these are the biggest myths that I come across. There are obviously more. But yeah, this is, so number one, that it is weight loss. Number two, that it is unsafe. Number three, that it is, one magic wand type of thing. So these are the three biggest myths that I do come across.
So with you being at Gleneagles Hospital, what equipments or infrastructure does this hospital offer to the patients?
So for me, especially when I'm doing any sort of aesthetic procedures, patients are not really unwell. If people are sick, for example, if someone has come after an accident, a small surgical site infection can, sort of be okay. It's not a really big issue. But for me, if I'm performing an aesthetic procedure, I don't want even that. So safety is my number one priority whenever it comes to aesthetic surgery. Isliye I prefer a hospital, which has the backup, which has qualified anesthetists who I would trust my life with. That is the way I always speak to patients. I perform and I do my surgery in a hospital where I trust the anesthetist with my life. Extremely good ICU backups, So plastic surgery has commandments that was written by one of Dr. Gillis, who was one of the pioneers of plastic surgery. And he mentioned that you always should have a lifeboat. So those lifeboats are, a good staff, good equipment. So for example, I use power assisted liposuction, which really decreases surgical time and really improves recovery, decreases post-operative pain, decreases the effort that I need to put in as well. You have extremely good OTs, with good equipment, good lighting. You have good staff members, and again, anesthetists who I would trust my life with. Everything really comes together in order for you to have a good experience, which is why I prefer to operate here.
So with all of this being so efficient, the cost is added to it. So what do you have to say about the cost?
One of the pitfalls that patients make when they are choosing a surgeon is going in looking at the price first. Okay, there is a lot that goes into the price of a particular surgery. It is not just the doctor's charges, because there are so many things that go into making this clock tick. You have to, the price will obviously reflect that. So my single greatest advice to a patient would be, don't just go blindly by price. If it's too good to be true, if it looks like it's too good to be true, it probably is too good to be true. Kidhar to ullu banayenge. Like, they say that if something is free, then you are the product. Right? So this is what the case is. So don't just go by the price. You need to look at other things. You need to vet your surgeon well, check the hospital where you're going to be operated, ensure that the lifeboats that I mentioned are available, and obviously the price will reflect that. But then getting a revision surgery or treating a complication is going to be way more expensive than the first surgery itself.
Correct.
So trying to save money, you're going to end up spending double or triple. So you might as well do it once and do it right.
One more question I am very much interested into is basically this liposuction and contouring. How many days of stay does it require in a hospital? Like how early the person can join back work?
Okay. So this is again something that people do obviously ask a lot. It depends on what procedures we are doing. Typically, whenever we are doing aesthetic procedures, it's not just one thing that we're doing. If I'm doing a liposuction alone, a hospital stay, like for example, for a gynecomastia, if I'm only doing a gynecomastia, then I don't need to keep the patient overnight either. You get admitted in the morning, your surgery occurs in the morning, and by evening we can send you home. Obviously, the first couple of days are going to be a little rough. It would feels like working out after a really long time. You feel that typical muscle soreness that lasts for around 5 days at most. But you are walking around from the day of surgery itself. You can get back if you're working from home, you have a desk job of sorts, you can continue that from maybe a couple of days immediately. लेकिन क्यों कर? आराम कर लो थोड़ा. Surgery हुआ है तुम्हारा. So just rest maybe for a few days, 3 to 5 days. Listen to your body. Everyone heals differently.
The similar goes for face contouring as well.
Everything.
Okay.
Everything in cosmetic, in aesthetics, whether we are talking about surgery or non-surgical, your timeline for your final results are between 3 to 6 months.
If you could just give a short take-home message for our viewers.
So the take-home message that I would give is, again, going back to the myths, liposuction is extremely safe. Body contouring procedures are extremely safe. They are science-based. However, don't choose your doctor just by looking at the price. Assess your surgeon well. Do your homework. Listen to your doctor. Ask questions. If your doctor cannot answer your questions, then find another one. You need to have a very clear picture of what it is that you want. Have realistic expectations and just have faith. I'm fairly certain you will get excellent results.
Thank you so much, Dr. Vashisht. Thank you, viewers, for being with us. We'll come up next with some other topic. Till then, thank you and goodbye.
Thank you for having me.
Medicine Made Simple. Powered by Gleneagles Hospitals, where good people make you feel better.